This is Dr. David Johnson, Quillen College of Medicine, East Tennessee State University, with a video on the endothelium and its role in hemostasis. The artery has a lumen through which the blood flows, and then it's surrounded by the endothelial cells, which are just one cell layer thick, and they are attached to the elastin-rich intima, which allows the artery to expand and contract as needed, and then that's surrounded by smooth muscle, which controls that expansion and contraction to some extent, and then finally collagen that gives it strength. The vein is very similar. It also has the one cell layer thick of endothelium. It has less elastin intima, less connective tissue backing it up, and it has less smooth muscle because it does not need to expand and contract as much, but it has a lot more collagen to give it strength. The artery needs to expand and contract because when the heart pumps, you get a pressure surge. However, the veins are more like a tube because it transports the blood back to the heart, and that involves pulling it back up, sort of like sucking a milkshake up through a soda straw. So here's the endothelium. It's in constant contact with blood cells and blood plasma, and it's a large organ, about estimated to be as large as 1 kilogram, with 4,000 to 7,000 square meters of surface area. A football field only has about 5,000 square meters, so it's a pretty large organ. So the elastin-rich intima also has collagen. Collagen's types 1, 2, and 5 back there to back it up and give it strength. The endothelial cells make von Willebrand factor. They also make tissue factor, and tissue factor, when the endothelial cells are damaged, is released, and that starts the extrinsic pathway. It has heparan on its surface. Heparan is not as potent as heparin, which is found from mast cells and used as a drug. Heparan is just on the surface, and it activates antithrombin 3 to slow clotting on the surface. Then once enough thrombin is made, it binds to thrombomodulin to start slowing the clotting down, because you don't want to clot the whole body, you only clot where you have the damage. And it also has tissue factor inhibitor, which also provides a way of slowing down the blood clotting cascade once you've made enough thrombin. It has tissue plasminogen activator, which activates plasminogen to plasmin, which degrades blood clots. And endothelial cells also make nitric oxide, prostacyclin, and ATPase, which slow platelet aggregation as well. So on the left, we have those reactions that favor thrombosis, and on the right, those that slow thrombosis. And if we have a damaged endothelium here, and we get a platelet plug, then the platelet plug binds via von Willebrand factor to the collagen, and that also stabilizes factor 8. The von Willebrand factor circulating stables factor 8. Then red blood cells come along, and then fibrin is added as well as part of the intrinsic pathway gets started, and that is the activation of 12 to 12 active, a star. And that occurs because of interaction with negative membranes and negatively charged collagen of that blood plasma protein. Additionally, the release of tissue factor from the damaged endothelial cells results in the start of the extrinsic pathway, as given previously. Then heparan on the surface of endothelial cells, it's not as highly charged as heparin, and it binds to antithrombin 3. That activates the antithrombin 3 so it can complex with thrombin and inhibit it. And it also inhibits factors 9 and 10. And once that's controlled, that prevents clotting along the surface, because the surface is the place where the blood is flowing the slowest, and you don't want any clots to form along there. So it's just a fail-safe mechanism to sort of slow up the clotting on the surface of the endothelium. And thrombomodulin, thrombin binds to thrombomodulin, and then that complex activates protein C, and that active protein C is a serine proteinase that along with protein S degrades factors 5 of the common pathway and factor 8 of the intrinsic pathway. Additionally, tissue factor inhibitor inhibits factors 7 and 10. of the 10 of the common pathway, and then 7 of the extrinsic pathway. And TPA activates the fibrinolytic cascade to dissolve clots. Nitric oxide is a vasodilator, so it diffuses out to the smooth muscle cells and dilates the vessels as needed, so the endothelium is very important in making that. It also makes ADPA is needed to activate platelets, and prostacyclin slows down platelet activation, or platelet slows them down, keeps them from working. Do all the good you can by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, as long as ever you can. John Wesley.